Hi, my name is Lillian. I'm a physical therapist at Physical Therapy First over at our Cold Spring location, and I am here with this week's PTF Tip of the Week. And in honor of Mother's Day, I have our pregnant Bree from our Clarksville office to help me with some demonstrations. So Bree, like most women, as their pregnancy goes on, is starting to experience a little bit of back pain, which makes sense if we look at how her weight is changing. So I'm actually going to have Bree turn and face that way for me and drop your hands to your side. And you can see that Bree's starting to get a little bit of an arch in her back here as the weight of the baby kind of pulls her forward. And that's naturally only going to get more and more exaggerated as the little one grows. So here are some nice core strengthening exercises that you can do to help offset that arch and keep that back pain a little bit under control throughout your pregnancy. Obviously, every woman and every pregnancy is different, so if you have any questions, please feel free to give us a call. We'd love to see you. Okay, so the first two that we're going to do actually start off laying down on your back. Okay, and if Bree just lays here, and again, she's got this nice little arch under her back. Okay, so what I'm going to have her do is bend both knees up, and then she's going to tighten really low down these muscles to sink this part of her back against the mat. And you should feel a tensing or a tightening pretty low down, almost under. For Bree, it falls under her belly, right here. Depending on how low you carry, you might kind of feel it over your bump. Just depends. Okay? Feel that? Mm-hmm. Now I'm going to have you bring both arms and both legs up. Can you still hold that? Mm-hmm. Okay, so she's still got it. So we're going to go on to the next step. And I'm going to have you move your arms up and down in a diagonal. And she's still able to hold that engagement, so I'm going to make it a little harder on her. Her arms are going to stay still, and her legs, one at a time, are going to come out and back in. And Bree's been practicing for me, so she can still hold that nice engagement, so we're going to make it one step harder. And we're going to do opposite arm with opposite leg. Good, and then back in. If at any point you lose that engagement of the lower abdominals or you lose control of that low back, then just step it down a notch. So this is a nice progression all the way through, an exercise that we tend to call the dead bug. Okay? The next one I'm going to have Bree do is a bridge. So again, she's going to tighten those lower abdominals, sink that back towards the mat, and then she's going to push her whole bum up off the mat. Good? And then while she holds that, she's going to straighten one knee, bring it back, and then the other, right? And her belly button stays nice and still the whole time. She doesn't really get a lot of shifting across the pelvis, which is really good. If we need to make it harder, go ahead and bridge. She can put her arms across her chest. She can bridge up for me, and she can straighten her knee. And you can see when she does this, it's a lot harder. She gets a little bit more motion here. So this one might be pretty challenging for Bree. And come back down. All right, you can go ahead and sit up. So at some point during your pregnancy, it becomes really uncomfortable to lay on your back, and those two will no longer be an option. So we've got some that you can do on your stomach instead. So Bree, if you get on your hands and knees. Good. And then again, as you get more and more pregnant, this weight is going to pull your back towards the table, and you really want to avoid that. So again, you're going to contract these lower abdominals, hold this nice flat back that Bree has here, okay? And she's going to do her arms first. Stays nice and level, looks really good through here. She's got really good core control still because she's been practicing. So she's going to stop with the arms and do just the legs. Again, holding that nice flat back. She starts to get a little bit of arch and a little bit of motion here. So this is probably hard enough for Bree. But if you need to make it harder, if you're good at controlling that, what you can actually do is, again, go opposite arm, opposite leg. This is too much arch in your back. You want to be able to control that side's better. Control how much, there you go, curve you're getting while you do this. It should really stay relatively flat. If you can't control that, back it down and just do the legs. Okay? The last one we're going to show you is a plank. Down on your forearms. Good. Same thing, holding this nice flat back, not letting the baby pull you down towards the table. If this is too hard, you can make it a little easier by just dropping your knees onto the mat, still holding this nice flat posture. When you plank, you're just going to try to hold for as long as you can, okay, with good posture, and then take a break and do a couple of them, okay? Last thing Bree's going to show us is a little stretch for that low back. She's just going to lean forward. As you get more and more pregnant and the belly gets more and more in the way, you can just spread your knees further apart so there's room for your baby to drop into. And she's going to feel a nice stretch, especially down here in that low back, as she keeps her bum on her heels. Does that feel good? Mm-hmm. Okay. And then if you feel like one side hurts worse than the other, which a lot of women will, you can actually angle this stretch a little bit. So she just walks her hands over to her right. Now she's got a really strong stretch over here on the left side. And she can hang out here. And then if she's feeling it more on the right, or if she just wants to stay even, she can walk over to the other side and feel that nice stretch through there. Alright, I'm Lillian, this is Bree with this week's PTF Tip of the Week. If you have any questions or if you'd like to make an appointment, you can call us at 855-PT-FIRST. Thanks so much.
Happy Mother's Day.
Happy Mother's Day.